Hello, my name is Pia Jeppesen and I'm a clinical professor at the University of Copenhagen in Denmark.
And my name is Marin Rimvall. I'm an associate clinical professor at the same institution in Copenhagen, Denmark.
So the background for doing this study is the fact that access to evidence-based treatment is still limited around the world for children and young people, even though there are effective treatment manuals available. So one way to improve access to treatment is by use of a modular and flexible program. And this is why we made Mind My Mind, which is a cognitive behavioral model-based treatment program for children and adolescents with the most common mental health problems.
And originally, about 5 years ago, we evaluated the effectiveness of 17 weeks of Mind by Mind treatments compared to management as usual across 4 different municipalities in Denmark. And the Mind by Mind was superior to management as usual with regard to the impact of everyday problems as rated by their parents using the Strengths and Difficulties questionnaire, the impact supplement. And also the Mind by Mind had positive effects regarding depressive symptoms, anxiety, school attendance, as well as more participation in daily activities. And these benefits were actually maintained after 26 weeks.
So Mind by Mind seemed to be an effective toolbox for the psychologists to use in the municipalities. And now we did a 3-year follow-up study of this randomized trial. And in the long-term follow-up study, however, we found no significant differences in outcome between the 2 intervention groups. And we saw that 25% of youth in both groups received a first diagnosis of mental health disorder during follow-up. However, the short-term benefits still suggest that the treatment program could be cost-effectiveness. And in Denmark, we have already implemented Mind by Mind as part of the national effort to provide free and easy access to treatment for all help-seeking youth.
So a lot of hope is actually being put into these early preventive programs. And the question is, should these long-term outcomes actually deter us from still working with these kinds of programs? And we think that that is not necessarily the case, but we really do need to work hard on improving these programs to actually have long-term beneficial preventive effects.
Exactly. And this is why we now add more booster sessions, and we have improved the guidance on how to collaborate with schools and mental health services, and we are also developing new models for treatment of new problems like problematic internet use, sleep problems and self-harm.